this work. We are really excited to share this with all of you and hope that this ignites additional inspiration to think about your partnerships different and what the possibility of Medicaid might bring.
Thank you so much, Toni, and welcome, Alex. We have prepped the group that they're ready for you to jump in. I hope you have screen sharing there.
I do. Hi, everybody. I hope you're doing good today. Happy Monday. Can you all see my screen? How are we doing, Andrew? Good. So I'd like to just begin by asking everybody to put their burdens down for a second. If the word Medicaid makes you a little sick to your stomach, I would say I get it. And some of us think it's sexy, so I just want to say that. But it's also something that's really important for the future of FRCs. So go with me a little bit. And I didn't do my background at all, but everything I'm about to talk about, I actually did. I was a therapist in the Oakland Public Schools. I ran a pediatric emergency department. I worked in juvenile justice. I worked in foster care. And then I led one of California's largest health systems. So this work I'm about to talk about is work that I learned by making payroll and actually running claims. And I am a FRC groupie, just to be clear. Like, I really believe in them, that they're a place where so many pieces of our fragmented social safety net coalesce around the experience of poor families. So I really believe in what you do, and I'm committed and have been committed for many years to try to get your money. And that's really what this project is about. All right. So if Medicaid makes you throw up in your mouth a little bit, set that aside and go with me on this journey. Yeah. So something's happening. In particular, Medicaid and child welfare are doing some things together that they haven't done before. We are finally accepting the hard reality that you don't treat away racism and poverty, and that there are big limitations to the medical model. And you're seeing massive movements across the healthcare system to look at partnering with social needs providers. So like, we are seeing this in many different states in many different forms. So you're seeing, probably, I'm guessing each of you have your own level of interest you are brokering and managing from health system players to address these things we call the social determinants of health, right? Like, it turns out that access to a doctor isn't the thing that helps you get healthier. It turns out meaning and connection, stable housing, safe communities, these are the things that help you get healthier. And the child welfare system is also looking at these same issues, meaning child welfare systems are increasingly investing in the types of things that keep children and families out of care. And so what that means is both of these systems are starting to coalesce around the type of work that you do. So you're seeing investment from community pathways and prevention plans, and you're seeing interest in the kind of work you do from behavioral health and traditional medical physical health providers. So you're kind of at a really interesting point. And I'm about to talk to you about a very incremental step you can take on this road to getting Medicaid funding. And I just want to apologize if there's people on this call who are really far down this road. This is just an intro and the beginning of like how to get Medicaid dollars. So what is Medicaid? It's an insurance program. And every state is different in the Medicaid reimbursement landscape. Your state has a state plan. It covers different levels of folks. Some states cover everybody, including undocumented folks, and some states don't. But generally, if you're an individual making less than $16,000 a year, you qualify for Medicaid. And if you're in a family up to about $30,000 or $40,000 a year, you qualify for Medicaid. Your children do, at least. MAC, or what I'm going to talk about today, is a component of the Medicaid program. So MAC stands for Medicaid Administrative Claiming. So there's traditional Medicaid that pays for like a clinical service or an interaction between a qualified provider and a qualified beneficiary. MAC is different. Administrative claiming accounts for all the things you do to make that other kind of interaction happen. So it's not for direct services. It's for the things related to making a direct service happen. And by the way, I'm impossible to offend. If people have questions, jump right in, raise your hand, bring it. But to understand MAC, you have to understand the architecture of all of Medicaid. And this is how Medicaid works. Think of Medicaid like a pot of gold in DC. To get $1, you have to put up $1. The kind of dollar you put up is called a certified public expenditure. The dollar you get from the feds is called federal financial participation. Together, they make up a Medicaid expenditure. This is true of all Medicaid expenditures. Like, you now know Medicaid. You can retire. You're done. You thought it was complex. It's not. It's super simple. This is Medicaid. But it gets really complex because of how we administer it. Let's take that federal dollar and show how it goes through the state and shows up in the lives of children and families. First, in most states, it's increasingly passing through the managed care plans. It's also running through county mental health departments, what we call the carve-out. Many states have what we call a 1916B waiver or a behavioral health carve-out. It also runs through school districts. They can bill directly. It runs through community health centers, public health departments, public hospitals, and the regional center, which is in California, what we call the World of Developmental Disability. But almost all states run their services and programs for children with autism or developmental disorders through a separate Medicaid program called something, but it's a 1915I and 1915H waiver. MAC, or Medicaid administrative claiming, can be applied to any one of these settings, meaning there is a MAC mechanism across them all, because even though they carve up the pie differently, MAC applies to all of them. So if you're helping someone get access to any one of these bubbles, that activity is eligible for Medicaid administrative claiming. And every state has a Medicaid administrative claiming plan that you can read, and you can rewrite it, as I'll show you we did in New Mexico. So this is how Medicaid works. So important to note, in New Mexico, we work through the state. In Sacramento County, we work through the county mental health department. And the FRC project that I'm about to talk to you about today, we work through the local public health department. So the MAC program exists in almost all of these bubbles, but how to access it depends on the architecture of your local safety net. So what are the negatives of MAC? It can take over a year to get any money back. So we call this revenue cycle. It requires a capacity. It requires capacity building, meaning you're not doing what you already need to do to collect the revenue. The work you're doing is the work that's eligible for reimbursement, but in order to capture it, you have to do a bunch of stuff. And you often have to hire someone from the outside to help you. And in the case of the FRCs, they paid us $250,000 a year for 2 years. So it cost a lot to get the claim. The good news, it's sustainable and ongoing, meaning once you start it, it never stops. And it almost always grows over time. You can usually make back your consulting investment within the first year. And when you get those dollars, they're unrestricted. You don't have to spend them on anything. You can do what you want with them. Obviously, the first rule of Medicaid is don't go to jail. You can't break the law, but you can spend them in very unrestricted ways. They're considered discretionary revenue in your budget. There are 2 ways to claim MAC. Something called direct charge, which basically means you write into your contract a percentage of the amount of money you get is for certain things. And then there's something called time tracking, which is where you must account for every minute of your time for an entire 40-hour work week, and it must match your payroll and accounting. And while this sounds super complicated, there's a bunch of timekeeping tools. There's probably folks on this call who've done this type of work. I want to say I'm kind of a fan of time tracking. First of all, you get more money when you do it that way, but it is more administratively burdensome and people don't like it. Anyway, we'll just say it that way. So what kind of things are reimbursable? And I'm just going to give you a couple examples of the codes. The first is Medicaid outreach. This is when you're talking to people about the Medicaid program. Like, it can be spent helping someone access care, or even learning about the program, or learning about what services is offered. It's basically like anything you're doing, like a health fair. When you help people actually connect to services, children or families, and that can be either teaching them about it or actually linking them, that's called referral coordination and monitoring. And FRCs do a lot of that. When you can actually help someone assist getting their documentation necessary to apply, and then arranging for transportation. These are just a handful of the most common codes we found in the FRC work that were eligible for reimbursement. So why was the FRC Alliance well positioned? Well, FRCs are on the front lines of connecting poor folk to Medicaid eligible services. Like, that's just the reality of it. And so when we looked at what FRCs were doing in San Francisco, we were like, man, there's a lot of that that's reimbursable. And when we sort of did the analysis of San Francisco's program, and remember, San Francisco is a very mature network. And I think we have some FRC folks who are going to talk after me about it, but we had a kind of table to work through. And there was a pretty significant investment. Between 10 and $14 million was already being spent. So if you remember that chart I showed you, you got to have $1 to match. You can't match nothing. So if there's no non-federal investment, MAC isn't for you. And remember, this is just one part of Medicaid, okay? Like in most states, Medicaid is a managed care program. So there's a whole separate strategy for getting managed care revenue. But for administrative claiming, you have to have money in your budget that's already non-federal to get a match on. So we initially thought we could get about $2 million in revenue. We ended up getting a lot less, just to be clear. Yeah, so one of the first things you want to do as an FRC is, how big is my budget? How much of it is non-federal? How much do I help poor people connect to services? And do I have the administrative capacity to play? That's the 4 things you need to think of. And I learned this because in a health system I led, there was a big FRC. And like I said, I was a groupie. This one is called the East Bay Agency for Children. And this is actually the claim that I ran for them for over 10 years. So I led a large health system with 14 hospitals and a big 911 system. And I was always like, man, we're not doing the right stuff. Like, the people doing the stuff are the FRCs. Like, look at what they're doing. So with this Family Resource Center in Oakland, California, we claimed $450,000 a year for 9 years on a $1.9 million budget. All right, are you with me? Their budget was $1.9 million. We claimed an additional $450K a year for 9 years. That was about 50 staff claiming 6 codes. And I had 40 other community-based organizations with this type of claim plan. So, like, just so you know, I actually did it. When we went into San Francisco, I was like, man, we're gonna do all this stuff. And by the way, just, you know, teasing, I got punched in the face. It was way harder than we anticipated, okay? But we were doing it based on this real experience that I'd had in Alameda County, where I led the system and had done this with one FRC, producing significant revenue every year for 9 years. So here's the 4 steps you do if you want to go after Medicaid administrative claiming. The first is you look at the potential revenue. You do an opportunity analysis. Like, is this right for me? Then you develop a strategy. How am I going to go get it? And it usually requires talking to somebody who knows your administrative claiming in your state. And there's a bunch of them. Like, I'm a California homer, so I'm not here to do it for you. Like, you couldn't pay me $1 million to do it if it's not in California, because I wouldn't know how. All right. So, but there are people in your state who do administrative claiming. And one of the important things to know about your strategy is that if you're a licensed person, if you employ a bunch of social workers, they get a higher rate than people who don't have a license. That's called SPMP, skilled medical professional. And then you develop a claim plan and you negotiate it with the state. When you implement it, the key is to understand how staff currently talk about their work, because almost all staff at FRCs are doing this stuff that's claimable, but they don't use the right words. Are you with me? Like, they're actually doing Medicaid outreach, but they think they're running a health fair. Like, they're helping mama get diapers and formula. They're actually arranging for transportation, okay? Like, part of it is just teaching them how their work already matches the coding that is out there. So that's like a translational challenge. And then you have these 2 paths you have to take. And as I'll explain to you in a second, we ended up starting out trying to do time study with 220 people and ended up abandoning the whole thing and doing direct charge. because basically it was during the pandemic. The FRCs were having so much trouble retaining staff, and there was 12 different organizations we were trying to teach how to track time, and it was just too much. And so we chose a much simpler claiming strategy, but that got us less money. And then you got to claim and submit the claims and track the money. So a bunch of paper pushing. So in San Francisco's case, just to tell the story of what happened in San Francisco, the KC Family Programs was very interested in sort of this role of FRCs in the emerging landscape of Medicaid and child welfare. So they funded us. We went out and met individually with every FRC, and we reviewed each of their budgets. And we then eventually looked at how much they could get if they time studied and how much they could get if they did direct charge. And what we ended up doing was projecting that we could generate about $750,000. Well, so let me go back one step. We did time study, and like I said, we got punched in the face. Like, people didn't fill out the time study forms right, and they weren't submitting them on time, and we were like basically acting like the cops. And so we went back to our collaborative and we're like, yo, this isn't working. You know, we're working too hard and people aren't seeing the value in it. And we initially were projecting about 400 to 500K, which was way lower than our 2 million because we couldn't get the time studies completed right. Like, they weren't matching. This isn't like a story of triumph, you guys. This is a story of like working really hard with a lot of details, being like, man, how come more money's not coming in? And so what we decided was, if we switched to a 20% direct charge mechanism, we could get more money and everyone would be happier. So that's what we did. So we initially projected 2 million. We ended up with 400 to 500K, and we switched to direct charge to get 750K. So last couple slides, and then we can just spend as much time as you like chatting it up. Sorry, I can't even see my own slides here. The kind of essential question in your opportunity analysis is the juice worth the squeeze, right? Like, for those of you who are in states where you already are working with managed care plans, there may be better strategies than MAC, okay? Like, North Carolina is creating a sub-capitation program where a little bit of money for every kid in the program is getting sent to social needs not-for-profits. That would be more lucrative than MAC. But if you're already getting money from your state or your county or tobacco money, or you're already getting non-federal dollars to do your work, you can enhance your revenue pretty significantly with MAC. But before you would proceed, you need to do this question of, is the burden and the capacity worth it? Like, how much money can I actually get? And do I have the right administrative structure and staff willingness and, frankly, executive leadership to walk this path? And am I willing to be patient and wait a year before I get any money? What we found is that each of the 16 FRCs we were trying to work with were really different. And each one kind of, I hope I'm not going to piss anybody off here. They didn't think of themselves as a network, okay? They thought of themselves as individual grassroots social justice orgs. So it turned out that the network was very difficult, like, to manage as a network, and we needed to individually dive in with each of the 16 FRCs, and that just was like a lot for us. And we just, as I mentioned, saw significant staff leadership and turnover, particularly at admin leadership. And obviously we were doing this during the pandemic, which made it doubly, triply difficult. But what I would say is that in every MAC claiming experience I've had, revenue has grown over time. So what we did is we invested a lot of time and energy in First Five to build their capacity, and that has been a good investment. And we ended up with an 18 to 24-month revenue cycle, not a 12-month revenue cycle. But that's partly because of some things at the state. In California, they were dealing with an audit. And I think here's where I'll end. Given the unique culture and business practices of FRCs, of each of them individually, we think that, like, a readiness assessment for MAC participation has to be done at the individual FRC level. Like, each one has to go through its own clear-eyed and honest assessment of, is this right for me? And outreach should be tailored to individual FRCs, and clear individuals champions need. The FRCs where it worked really well, we had as executive buy-in. And I'll just do two quick little technical things to end on here, Andrew, and then I'll take the slides down so we can talk. There's something called revenue return, which means we pre-negotiated that 90% of the new revenue received went back to the entity that did the claim. This is important because whoever is claiming the federal matching funds is going to be a public agency. And you want to pre-negotiate with them how much they keep and how much they send back if you're doing the claim. Because if you don't get your money back, people won't do the claim well. Like, everyone has to understand that their bread is being buttered with this administrative burden. And whoever that public entity is often needs some love and kindness too, because they're just like us, doing the best they can in tough times. All right, let me, there's, just so you guys know, I will make sure Andrew has this deck. I think he already does, but if he doesn't, I'll make sure he gets it. There's some technical stuff we added in an appendix for folks, if you want to look at it, which is actually the activity codes and actual claim structures and a time card. And here's some examples as well, so you can see exactly some of the numbers we did, but that stuff's kind of boring. So let's chat it up.
All right. Thank you so much, Alex, for walking us through that and all the prep to develop such a comprehensive deck covering key points. And want to turn next for the funder's perspective from Theresa Zighera at the at San Francisco's Office of Early Childhood, and what you would add in addition to what Alex shared is good to know for the lay of the land and how this worked, lessons learned, and then we'll turn to questions that folks may have. So be thinking about what you'd like to ask of our presenters.
Sure, thank you. Don't have a slide deck, so I'm just gonna highlight a couple of Alex's points, build off them a little bit to talk about the funder perspective. And a couple of key things that were important, and also a couple of other considerations around readiness that might be helpful as you start to answer that question about, is this worth it, and what would we need to think about in advance? So one, I think that the role of, and I will say, I'll use the term quasi-governmental funder is important here. So as Alex showed in the first couple slides, where the journey of the Medi-Cal dollars down to the CBOs. And so we actually in San Francisco have almost this we have a role of two government funders, and I'll talk a little bit about the role that each one plays and kind of the pluses and minuses of that for you all to think about. So one is the dollars flow through from the state through the Department of Public Health first, through our county Department of Public Health. And then we are also a county department, but being the funder of the Family Resource Centers, we are very close to the ground with the Family Resource Centers and very close with our family support, our Family Resource Center Alliance. And so having that, whether it's your county department, whether it's your state department or a county department or a quasi-governmental or your family support network. I know in some states, those networks also can act as in the role of funder or having dollars pass through. And so having a funder who is close to the ground with the Family Resource Centers was really helpful for us. And I think would be an asset for any of you and would be an element to think about in terms of your readiness. And if you have that type of intermediary who knows, so our Department of Public Health knows Medicaid and Medi-Cal, what we call in California Medi-Cal, but they don't know Family Resource Centers very well at all. So as the dollars flowed from them to us to Family Resource Centers, we were in the funder relationship with Family Resource Centers. We knew their scope of work, we knew the directors, we knew their data collection systems, we knew the challenges and things that they were grappling with on the ground level. We knew their capacity, we knew we had other entities that were already doing on the ground training. So all of those kinds of things to be able to bring to bear in this type of activity are really important. So that's one thing to think about, is that how you can leverage your role of network, or if you're a funder at the state level, your role being close to family resource centers does become critically important in this effort, and to think about how you can leverage that. And to add on to that, I will also say, yes, we started this in time of COVID. In some ways, I think if it hadn't been COVID, we might never have done it. We were all trying bold, innovative, creative things. So I think on the one hand, because it was COVID, it almost opened the door for us to try things that were new and different. But as Alex pointed out, it did also create some of its own challenges. I'm a bit of an eternal optimist, and so I do like to think still about where we will continue to take this in the future. And so in reflecting both on the past and in moving forward and touching back to this role of funder, I do think that as we now know more about what we need to have in place and need to know more, now that we know more about how to support family resource centers in this work, yes, staff turnover is always a reality. But we as funders are used to training and building capacity in the context of staff turnover. We are used to monitoring programs and setting up billing and accountability systems and data systems in the context of ongoing staff turnover. That has been a feature of the work since 2009. It always will be moving forward. And so I do think that as we continue to build our capacity in that kind of intermediary role, as our Family Resource Center Alliance builds their capacity in the intermediary role, I can see us revisiting with agencies the time study billing. I can see us doing more training with agencies about direct charge. I can see us supporting capacity building. I can see us stepping in when there's been high rates of turnover and supporting an FRC to get back on track. And all of those things are things that maximize your revenue potential. So that's one. The funder intermediary is important to get started, but it also plays an important role as this will continue to grow and build out. The other thing in terms of readiness is that we did have a very mature family resource center system. And so whether your family resource center system has been around for a long time, a shorter amount of time, I would say that having your initiative or your center around for a long time will give you a more solid foundation to take this on. Even if you might be on the shorter time period end of experience or your network, the other things that are important are documentation. So maybe you're in an initiative that's been around for 5 or 6 years, not as long as 10 or 15, but your centers are very accustomed to documentation around the work that they're doing through a data system, through some standard sets of services, scopes of work, contracts, anything that gets your centers used to documentation and that allows you to have that documentation to do that analysis that Alex mentioned, the juice worth the squeeze, looking at your budgets. So having that documentation, those systems already in place, I would say is a pretty key piece of the readiness that would be needed to embark on this. And then just the other thing I will touch on, I see my other colleagues, Toni and Jenny, if they want to chime in, but I think we're also seeing the reality that Alex mentioned, whether it's through our Human Services Agency and child welfare or through managed care plans and the health plans, we are seeing these opportunities come down. And they often come to us first, being in the role of a county department. And so at this point in time, this is all we have another effort around case management. We have the Families First Prevention Services Act that we're partnering with child welfare on. And so all of these efforts, kind of the wave of the future, and they all will necessitate a similar type of fiscal interrogation and paperwork in place, and potentially even time study. So yeah, time study is nobody's favorite word, and our programs were not a fan of it. But I think that's also on the horizon if we are going to maximize not just this funding stream, but the multiple other funding streams that we do see coming down the pike. And so supporting our programs in that work, and also building our capacity as funders or intermediaries and being able to support programs in that work, I do see it being just something that we are going to be called upon to do more and more. And that's it, but I'm happy to take any questions.
All right. And to make sure, well, thank you, Theresa, to make sure we round it out with all of our guests here, Jenny and Toni, anything else you want to add?
Nothing from me.
Right. Thanks, Toni. And Jenny joining us from Safe and Sound. Safe and Sound in this story has the role of leading the network of FRCs in San Francisco. Jenny, anything else you want to add to this?
Sure, and I apologize that I was late. I'm actually on a college tour with one of my sons. But I just really wanted to add to what Theresa, I think Theresa captured most of it, but in our particular role, extremely helpful to be able to look at these opportunities collaboratively. So if you are in a state where there is an opportunity to join a network, or you think of pulling together a network, San Francisco is very fortunate in that we have 26 family resource centers, and we just expanded our network to include 40 organizations. But we, in conversations with our public partners, Theresa of Department of Early Childhood, and with Department of Public Health, and conversations with Alex, this idea, was proposed to us, and we could really work with our members and get the buy-in and start thinking about how to get the support. And we acted in the role of, we are the liaison. So we had the conversations with the public partners. They were also having them with individual members, but we sort of set it up. And then when there are issues, we were able to be the intermediary in those issues. And as Theresa mentioned, we are fortunate to be able to play that role also with other opportunities like Families First. And so I just think that's a really key part of this process. And we're also looking into other Medi-Cal or Medicaid benefits going forward, such as ECM, enhanced care management, and we are looking again to play that role. Can we provide some of that technical assistance, particularly the small community-based organizations? And thanks. Yeah, anybody, any questions, or I'm happy to, provide our emails if those come up. So Andrew has all of our contact information.
Okay, thanks. So to that point of it takes a village, you now heard the whole round of perspectives on this. And Alex, now that your colleagues shared here, anything else you want to add with what they just touched on?
I'll mute myself. No, I just, man, I need to honor the person who made me possible. So I went to work for a big public system, and the finance director, her name was Vanna Chavez. She went to work for Alameda County, where I worked, when women were not allowed to wear pants. And she worked there for 40, she was born in a trailer in Hayward. She did not have a college degree. And she worked there for 44 years and became the finance director of a $2 billion health authority. And she said to me once, you have to hustle as hard for federal matching funds as poor people do for rent, or you're not honoring their struggle. So get your hustle on. Like, don't see this. There's no, poor people need us to have as sharp a pencil as the bad guys do. So this isn't a game where like anyone's going to start handing you money. Like, you got to rip it out of their hands. And it's not easy, and it never will be. So like, don't let anybody tell you it's going to be like, oh, just drop this code. It's not. It's going to be hard, and it takes years, and you'll get better at it over time. But just in the memory of Anna Chavez, who passed away last year, get your hustle on and go get that money.
Thank you, Alex. So looking for questions that folks might have, if you want to raise your hands so we can call you to come off mute, or type into the chat. I'll just kick us off while we're waiting for folks to do that. With the question is that maybe on folks' minds is, so the family support field and family resource centers are a unique kind of tribe, as you know. And I came to FRCs from the behavioral health world, and the behavioral health world is all about, Medicaid and codes and time studies and all this. So curious, especially because you navigated those worlds, Alex, is how did you see being able to do this in a way that supports FRCs to have the capacity to do this, but also doesn't represent a cultural change? Because I think there's hesitance around that. Like, if we want to work in behavioral health, we work in behavioral health. Like, we don't for a reason. So any thoughts about how do you see being able to bring this in without it taking over, in other words, for any
Yeah. Well, that's one of the reasons we picked MAC for that. Thank you, Andrew, for that question. Like, how do you purchase something without appropriating it, right? Like, how do you keep the beauty and spirit of what you do while also managing the administrative burden of it? What makes MAC interesting is you're getting money for what you're already doing. So you don't actually have to do anything new from a service perspective. You have to do this from an administrative perspective. Now, if you have master's level clinicians, LPCCs, MFTs, LCSWs, if you employ those type of people, there's better money for you than MAC. Okay? So let's just be clear. The healthcare systems are dying and thirsty for master's level clinicians to pay. So MAC isn't the play there. That's a behavioral health play, Andrew. That's a separate conversation. What makes MAC so good is you're getting money for what you're already doing. You don't have to have a license to do it. And there's no contract, right? Like, no harm, no foul. If you don't submit a claim, you're not losing money. You're just not getting the enhancement. So I consider it a good training ground for Medicaid. It's a good place to dip your toe in. Now, Jenny mentioned other benefits that pay $500 per member per month, like care coordination and case management benefits. That's another consideration for you guys in the FRC world. But a play to start and to go with not a lot of risk is administrative claiming.
Thank you, Alex. All right, questions, thoughts folks have?
And also just touch a big breakthrough aha moment for us early on was when we were all together in a meeting with the family resource centers, their directors and their coordinators, talking about the possibility of this initiative. It was maybe an hour-long meeting, maybe a little bit more. Alex was there giving us a presentation. And at one point he stopped and said, if we were doing MA, this entire meeting would be billable for all of you who are sitting around this meeting space for the last hour plus, right? So yes, I mean, there's definitely administrative burden and administrative paperwork. We know that can detract from time with families. We are certainly always trying to balance that. But the things that are billable are things that Family Resource Center staff are already doing, and at multiple levels. And so that was a big aha moment for us in terms of, oh, how many meetings are we having just talking about the possibility of this, and this could all be billable? So
Thanks, Theresa. Important aha moment there, sounds like. And Jenny wanted to weigh in.
I just wanted to add, I mean, another aha moment from the CBO perspective is that if you have really innovative philanthropic partners like Casey Family Programs, this is something we are seeing that we are trying to take into other areas also, in terms of working with philanthropy organizations to say, look, there are these other opportunities. If you help support the infrastructure, you help support the technical assistance to get this going, we may then be able to leverage public funding to carry it forward. And it also, things like this helped us become a stronger coalition, because we were able to say, okay, look, because we all work together, we were able to get this support from this big national philanthropic organization, this big national foundation, and there may be future opportunities. And we also, introduced them to your work. Casey Family Programs did an amazing profile, which I don't know if this was included, a paper on this work. And so, and they interviewed several of our partners. So again, it's an opportunity to highlight your work in other areas.
Thanks, Jenny. And Toni, if you can hear us, because Casey's been named here, this was a significant investment from Casey to help support this, from what we've heard. And I think many of our members may be thinking, wow, where do we find those kinds of resources to explore this, knowing it pays off in the long run, but wondering how Casey saw this opportunity, or your thoughts about how states might pursue resources to explore this, given Casey's strong support of this first effort.
Yes, thank you. I think one of the things that Casey is really interested in is advancing the field from a return on innovation. And is the juice worth the squeeze? But I think importantly, it is also important to learn, like, what are the parts of this that we're challenging, and what are the conditions that have to be in place to make this successful? And so, as many of you know, or may not know, Casey has a relationship with every state. And because of that, there are strategic consultants, similar to my role, that are available across the nation that could help create a partnership. Maybe not to the same degree as this, because we have already learned from our site in San Francisco, but we are excited to continue to demonstrate and spread the knowledge that we have learned. I'll also drop the brief in. I'm not sure if you shared that already with the membership, but just as a reminder, there has been a lot learned, and such a great opportunity for the nation to learn about the value of our family resource centers, and that the work is being done and has a potential funding stream that is in the entitlement category.
Thank you, Toni.
These are great questions. Catherine, whoever you are, you're one of my people. But the answer to the question, your second question, which is also a great one, you have to track to the minute. So if you have a time tracking tool that tracks to the minute, it can be any, like, there's the system's agnostic, like the claim is agnostic. So examples are like Time Study Buddy or Optimus or Fairbanks or PCG. They all, like, there's about 100 million tech companies that'll sell you a thing. So to answer Catherine's second really good question, as long as your time study tool accounts for 100% of your paid time, you can use it. And just for everyone, like I did these time studies myself as the CEO of a system that had 7,000 employees. I did them in pen and with blue ink and paper for 9 years. Like, so you can do them on paper too. Though I don't suggest that if you want your staff to still like you. The new tools are really cool. You put in what you did and then they automatically fill your time in. So we did a study of the folks in San Francisco, and it took on average 4 minutes a week. So let's say at first it takes you 10 or even 20 minutes. And just one last soapbox comment. I got a lot of pushback from various staff over the years about, like, you know, what a burden it was. And I was be like, man, go work for a Fortune 500 company or go work for a law firm. Like, in what world should we not be accountable for everything we do? Like, I think it's as much a culture thing in social justice work as it is an administrative burden. And I don't yet know how to talk about it or sell it in a way that makes people feel good about it, but it can be done. It's just takes executive sponsorship and leadership.
Thanks.
Catherine, another great question. It doesn't matter. The time, you do not have to be credentialed or licensed in any way, shape, or form to claim MAC. So if your time study has the capacity to include them, you can use it.
All right, other questions?
Maybe I'll do one quick technical thing, Andrew, just so
Sure.
if you're already this full on technical stuff, close your ears for a second. The child welfare space has historically claimed 4E, right? So have you guys heard of that? 4E claiming? 4E is to foster care what Medicaid is to MAC, okay? So if you are working with your child welfare or social service agency, they are sometimes have been claiming 4E in a similar way, but 4E has something called the look back, which basically means a decreasing number of kids are eligible for 4E because of a law that was passed. So again, if this means nothing to you, ignore what I'm saying, okay? But what it means is that child welfare agencies are increasingly interested in using MAC because of the declining eligibility rates of 4E, okay? So again, this is just for the technocratic finance people on the call. If you are working with your social service agency or child welfare agency and getting money for like prevention for child welfare system involvement, you might want to talk to that agency about looking at MAC instead of 4E because MAC is better. So,
Can you talk about why it's better?
Yeah, right. So we're in the weeds, y'all. So so breathe out and
I
stick
think
with
this
me.
is an important point, though.
Yeah. This thing called the 4E look back says that you're only eligible for federal matching funds if you were at a certain income level in 1996, I think it is, Toni. It might be 1994. But it's not adjusted for inflation. So every year, 1 or 2% less kids get eligible. And now in most states, less than 50% of kids are eligible for 4E. When you submit your claim, it gets reduced by the percentage of kids you served, in this case, kids who are eligible. It's called the discount percentage. FRCs only work with poor people. So almost everybody you work with is eligible for Medicaid, but less than half of the kids you work with are going to be eligible for 4E. Are you with me? So on the back end calculation, MAC tends to be better than 4E and it will only get increasingly better. I hope I didn't turn anybody off or get people mad or sick to their stomach, but it's just important because I know a lot of FRCs have partnerships with foster care, and I think the more FFPSA comes into play and systems invest more in preventing families from losing their kids, these considerations of which federal matching system to use are going to become more and more relevant. And if you can get a contract from a managed care plan, do that. That's your best play, okay? Because in most states, you're seeing more and more reliance on managed care plans. So if you want Medicaid money, your first and best play is the managed care plan. But if you want to just dip your toe in and start to play, see what you can get, MAC would be the way to go. Andrew, I also want to acknowledge it can be hard in group settings to have these kind of conversations because each one of you is different. And that was a little bit of what I was trying to point out about our experience in San Francisco. It's like we had to actually get down and dirty with individual FRCs and dig into their budget. And it actually doesn't take that long. So I just want to literally, there's not someone here who in half an hour with someone like me couldn't figure out if it was worth the squeeze. So it's not a big lift to do that number one in our, opportunity analysis. It's literally keep your heart and mind open up your books, talk to someone who knows, and you will know quickly if it's worth your while.
Yeah, that is a great segue, Alex, to asking as folks may take this information in, share it with others in their states, want to reach out further. What might that look like, and what would you suggest?
Yeah. So I haven't talked to Toni about this. I would almost want to defer to Toni, but I'll say what I think you should do. Look at your budget and determine how much money of it is non-federal and public. Non-federal and public. And if it's more than $500,000, reach out to Casey Family Programs or your state Medicaid leadership and ask how you might be able to participate in administrative claiming. If it's over $1 million, call me, send me an email, and we can go from there. I'll put my email in the chat. Toni, we didn't talk about this beforehand. That was off the cuff. I don't know how you feel about what I said.
No, that's exactly right. I would suggest that if there's an appetite within the state that you are operating FRC, it's an idea to think about the ability, and I think your advice is excellent, Alex.
Just for folks who want to know, a buddy of mine became the child welfare director in New Mexico. And New Mexico is heartbreakingly poor. It's actually unbelievable. 75-80% of all children are born into Medicaid. It's I'm very familiar with poverty and had not seen anything at a state scale, anything like it. And we shifted their foster care and juvenile justice system from 4E claiming to MAC. And we grew their revenue from $150,000 a year to $4 million a year. So at the system level, these tools are very effective. And we have to actually rewrite their state plan, but we did it all in a year and a half. So there's some big swings for the fences here. But the key thing to think about is, remember how I said Medicaid is a pot of gold in DC? To get $1, you have to put up $1. You could distill my career to looking for that $1. So if you have an FRC that's fully funded by federal sources, like federal block grants or TANF, like Catherine said, this isn't for you. But if you're funded with state resources or local taxes or tobacco money or opioid settlement money or those kind of things, non-federal resources, then this is worth exploring.
All right, and put the PDF of today's presentation in the chat for folks. We'll also share that out in the member memo. Is there anything else folks want to ask about, check in about here?
When the PowerPoint deck comes out, you're free to cut and paste and use however you will, rebrand it, take out the things, put your own colors on it. You're, no permission required.
Okay, well, if there's nothing else, then a big round of applause to thank our presenters for sharing this cutting edge work with leveraging FRCs, with drawing down Medicaid funding. Not easy at all, and we benefit from your struggles and learning. So thank you for sharing them so generously with us. And we'll turn things back to Gail.
All right. Well, thank you all of us for joining us, and I hope you found that interesting. It was a lot of information, so we'll look forward to getting some of those. If you haven't pulled them down from the chat, you still can save that and use that as your time. And I really hope to see all of you next month in DC. Again, we won't be having our meeting on Zoom next month, but we will be in person from May 6th through 9th. So I hope to see you all there, and hope you enjoy the rest of the day, and have a nice month. Take care.
And Toni, did you want to say anything by way of introduction? First, I did tee it up before you came, but anything you want to say first before we turn things over to Alex?
No, I'm going to apologize in advance. I am going to be on the road. So Alex is going to take the lead for our presentation today, but as a member of KC Family Programs and the lead of this work, we are really excited to share this with all of you, and hope that this ignites additional inspiration to think about your partnerships different and what the possibility of Medicaid might bring.
Thank you so much, Toni, and welcome, Alex. We have prepped the group that they're ready for you to jump in. I hope you have screen sharing there.
I do. Hi, everybody. I hope you're doing good today. Happy Monday. Can you all see my screen? How are we doing, Andrew? Good. So I'd like to just begin by asking everyone